30 years ago, the Journal of Public Health Management and Practice was founded by Dr. Lloyd F. Novick, a primary care physician and seasoned public health leader whose previous appointments included Commissioner of Health and Secretary for Human Services of Vermont, Director of Health Services for Arizona, and many others. But the story of JPHMP began even earlier, during the height of the AIDS epidemic. In 1987, Dr. Novick, then president of ASTO, testified before the Senate Finance Committee on the non-discrimination of AIDS patients, a pivotal moment in public health policy. 2 years later, he published a groundbreaking article in JAMA on the prevalence of HIV in women in New York State. His work became widely recognized and was frequently quoted in the New York Times and other major media outlets. By 1995, now serving as Deputy Commissioner of the New York State Department of Health, Dr. Novick testified once again before the Senate Finance Committee, this time to discuss the Vaccines for Children program, advocating for the protection of public health. Later that same year, recognizing the need for a platform to bridge research and public health practice, Dr. Novick launched the Journal of Public Health Management and Practice with Aspen Publishing Company. An editorial board was formed to guide its mission, with 6 remarkable original members still serving today. Since then, JPHMP has grown into a cornerstone of public health, driving innovation and advancing the practice of public health management. Through the years, we've celebrated milestones, special issues addressing emerging health challenges, and impactful partnerships with leaders in the field. In 1997, JPHMP increased its publication frequency from quarterly to bi-monthly, adding case studies and a focus on public health leadership. In 2000, Dr. Novick received the prestigious Herman Biggs Public Health Award for his efforts to improve immunization rates, reduce TB and STD incidents, and strengthen public health infrastructure. Other key moments followed. In 2001, the journal issued its first call for papers on the subject of public health informatics. In 2002, Wolters Kluwer acquired the journal. In 2003, JPHMP published its first supplemental issue on diabetes prevention and control. In 2004, NACHO began contributing a regular column called News from NACHO. Later that year, Ed Baker and Janet Porter launched the Management Moment column. In 2007, Dr. Justin Moore joined the journal as associate editor. In 2008, Desmond Tutu wrote a high-profile commentary on health disparities and the need for partnerships to achieve health equity. In 2011, Dr. Novick won the APHA Health Administration Section Award. In 2012, ASTO began contributing the State of Public Health column. In 2014, JPHMP leaders, editorial board members, and public health partners, including the de Beaumont Foundation, ASTO, and NACHO, held a strategic planning session to strengthen the journal for future challenges. In 2015, the de Beaumont Foundation became a sponsor of the journal, and in 2016, we launched JPHMP Direct to broaden our reach with digital content like podcasts and webinars. Throughout the years, we have convened meetings with our incredible editorial board, both at APHA as well as virtually, to continue advocating for many of the same issues facing the country back in 1995: healthcare reform, workforce development, health department accreditation, informatics and capacity building, and much more. And we couldn't have done it without one visionary leader, Dr. Lloyd F. Novick, whose tireless dedication has set the stage for our next 30 years and beyond. Thank you, Dr. Novick. As we look to the future, JPHMP remains dedicated to supporting public health professionals and shaping the future of public health practice for the years to come.
Well, many of the challenges in 1995 were similar to ones we have today. First issue was on health reform, universal health insurance, but that was the Clinton proposal. And there's an interesting story there that I had an entire issue with articles about the Clinton proposal, but then shortly before the issue published, while the issue was in proofs, the Clinton effort failed, and we had to edit the articles in the proofs to show that the proposal had failed. Many of the issues then were similar to what we had today. We had issues on preparedness, issues on workforce. The purpose of the journal was to give a voice to public health practitioners, encouraging public health practitioners to actually contribute to the literature, because we thought their viewpoint was very valuable, and we thought also by them contributing to the scientific literature, they would not only make the scientific literature more rich, but that they would improve their job performance as well.